And we begin tonight with breaking news, the kind of news that paramedics and those on the front lines have been so concerned about.
Exactly. Channel 9's Gina Esposito has just confirmed that a medic here in Charlotte has tested positive for COVID-19. Want to go now live to Gina. Gina, I understand you just finished speaking with the medic about this. Tell us what you've been able to confirm about the patient.
Yeah, I just spoke with medic leadership in the last 30 minutes. They tell me that a paramedic has tested positive for COVID-19. To put this into perspective, they tell me they have tested 6 employees with symptoms, but this is the first and only one that has tested positive. Now, this is what I know about this case. They tell me that the last time that paramedic worked on an ambulance was Thursday. I'm told the employee took their temperature before their shift and they were fine. On Sunday, the employee called medic to report they had COVID-19 symptoms. Medic says their employee took the test on Monday and results today showed they have the virus. I asked the medic if the paramedic may have got the virus while transporting a patient.
This individual had not transported a COVID positive patient. However, they've been in and out of the hospital systems. They've had many high-risk interactions.
Now, there are typically 2 paramedics that work on an ambulance, and I asked a medic about that. They tell me that the employee who is working with the other employee who tested positive never showed symptoms and is not in quarantine. I'm told that employees here at Medic have been notified about this. Back to you.
And Gina, we know a lot of medical workers have been concerned about their supply of that personal protective equipment. What did you hear from Medic about that?
You know, Medic says they have enough N95 masks and gowns, that protective gear, to last them for a couple more weeks. And right now, they're working with their suppliers to get more. And while they're working on getting that protective gear for their paramedics here, they tell me that 911 calls have actually been down. Take a look at this. They tell me between March 18th and the 26th, Medic averaged about 280 transports a day. During that same time last year, they averaged about 321 transports. So they're transporting 40 fewer patients each day. Now, Medic says the safety of their employees and the patients that they transport is a top priority. I'm working to get more details on this first confirmed case. I'll have more coming up at 6 o'clock. Back to you.
All right, Gina, thanks for the update on that information. I know you'll stay on top of it for us. And of course, our thoughts are with Medic and that employee right now fighting the virus.
And tonight there are growing concerns at Charlotte Douglas Airport after reports that at least 2 workers are reportedly now infected with COVID-19. After receiving several calls, we reached out to a local union and they did confirm to us that 1 gate agent and a baggage handler at the airport have now tested positive for the virus. Our Tina Terry tonight is live out at the airport. And Tina, you learned more about a gate agent today. A family member told you that that person is in the ICU and on a ventilator, so this is a serious case.
Such a serious situation, Scott. That family member told me that her loved one is in stable condition right now, and as they stand together as a family against this, that loved one is concerned about protections for employees here. Just days ago, that gate agent for Piedmont Airlines was inside Charlotte's airport helping hundreds of customers. Now she's in the hospital.
My loved one once, and then a few days later, not having gone anywhere else, she started having symptoms.
That family member, who asked to remain anonymous, believes that her loved one contracted COVID-19 at work, and she believes more should be done to protect workers, like screening employees and customers.
We haven't done any temperature checks on employees or passengers.
Today, a representative for the union that represents ramp and customer service agents at the airport said they have been pushing for more worker protections.
But we have made some requests for thermometers. You know, we're trying to find a way to make it possible for all of our employees to social distance. And it's really not that easy working at an airport with people traveling everywhere.
On the phone, American Airlines told me there is a low supply of thermometers right now, and even if they had them, checking every employee's temperature would be very difficult logistically. She said they are urging team members to monitor their own temperatures and reach out to a health professional if they feel ill. And that family member was also concerned because she has heard that workers here are not wearing gloves or masks inside of the airport. Now, I did reach out to American Airlines. They told me there's no CDC guidance for this. They are allowing, however, employees to wear those gloves and masks, but they have to provide them for themselves. Back to you.
So much concern for people about gloves and masks. Even some hospitals don't have them. Tina, thank you. Now, the employee we do know about, encouraging, of course, to hear that they are in stable condition, which means they're not getting any worse. But, of course, prayers out to them and their family that they recover and recover quickly. Now, just last week, Channel 9 reported that an American Airlines flight attendant had died from COVID-19. At the time, 2 flight attendants who wanted to remain anonymous raised concerns about safety conditions, saying flights they thought should just be completely stopped.
And sadly, yet another death to report in North Carolina, and this one, a man who bravely put his life on the line to protect the public.
Yeah, hearing that the first law enforcement officer has lost their life to COVID-19. A sad situation. Now, the sheriff of Montgomery County announced the death of one of his deputies last night in Pinehurst. Deputy Bud Poundpachan was a 14-year veteran with the department and also served as a school resource officer. After having allergy-like symptoms, he eventually saw a doctor, and then later he tested for COVID-19. He went to the hospital Monday and he died last night in intensive care. That deputy, Erica, leaving behind a wife and 5 children.
Yeah, our hearts certainly go out to his family and to the Montgomery County Sheriff's Office tonight. They're in our prayers. North Carolina reporting a total of 10 lives lost so far. Out of nearly 1,600 positive cases, 444 of those are in Mecklenburg County. We want to add to those numbers for you to bring things into more context, give you some more perspective. The state updated today that about 26,000 people have been tested. Now that means that number of 1,584 equals only about 6% of those tests have come back positive. There are another 5,000 tests still waiting to be processed right now, so we should know the results of those soon. In South Carolina, 26 people have now died from COVID-19. Nearly 1,300 others have tested positive in the Palmetto State, and that includes 66 in York County.
Just 2 minutes ago, a new order forced non-essential businesses in South Carolina to close down. Governor McMaster issued that order yesterday to shut down entertainment businesses like tourist attractions and theaters. Recreational and athletic facilities also have to close, like fitness centers, and no activities on public playgrounds. And close contact businesses will also be shut down, including barber shops and hair salons.
Under the stay-at-home order, many families are now spending more time together at home in close quarters. And with the added stress in our lives, unfortunately, that is leading to an increase in domestic violence cases in Mecklenburg County. Last month saw an 18% increase over March of last year. Channel 9's Mark Becker met with CMPD today about this troubling trend. Mark?
Yeah, Erica, I guess we can stand here and say we're a little surprised that overall CMPD says crime is pretty flat. We're about where we were at this time last year, but there are several areas of concern, and one of them, as you say, is domestic violence. With people staying home, there's going to naturally be more tension and more calls here for help. In fact, CMPD says they got 517 more domestic violence calls in March than in March of 2019, and that represents that 18% increase you spoke of. They can't say with certainty that it's because of the order for people to stay home, but they're continuing to answer those calls, and also suggest that there are other resources out there, including Safe Alliance here in Mecklenburg County. Now, their director, Karen Parker, told me this afternoon that they also saw a 40% jump in calls to their hotline in early March.
We know that domestic violence is all about power and control. So when a victim is stuck inside a house with a perpetrator, that gives the perpetrator more of an ability to have control over the victim, and it can be very dangerous.
Now, Parker told me their shelter here in Charlotte is full. They actually had to, because of social distancing, send some folks into motels. But they are still taking calls, and they say by all means, if you have a domestic violence situation, call 911. Erica?
Yeah, especially thinking about those children who are living in those families during this time. Thank you, Mark. Now, if you're watching and you or someone you know needs help to escape domestic violence, we'd like to share this resource with you. Call Safe Alliance. The number is 980-771-HOPE.
Well, stocks really took a hit today on Wall Street. As you can see, investors still just not sure about the length and the ultimate impact of this virus on the economy. The Dow fell more than 970 points and the Nasdaq dropped almost 340.
There was just one state park left open in our area to hikers, and now it's being shut down. At sundown, Lake Norman State Park is set to close down indefinitely. That will be joining Crowder's Mountain, Morrow Mountain, and other state parks too. Our meteorologist John Aaron spoke with park officials who tried to keep it open as long as they could, but they said people just weren't following the rules.
Yeah, in the end, it's a county decision, and they say, you know, this beautiful space is just drawing in an influx of people from all over the place, not outside the county, outside the state for that matter. But it's also, you know, these trails, you look at the space here, they're not much more than 4 feet or so. It's just impossible to maintain social distancing. People will be walking in large clusters. And let's just say you had a group of runners or hikers coming in from behind you and pass by. You'd literally have to move off the trail so they could get through.
Our staff on the ground saw people were not doing that. People were also crowding at overlooks in numbers of 20 to 70 people in one, you know, not big area, and that is kind of the opposite of what we're supposed to be doing. I think there's this misconception that since our parks are big, that people aren't running into each other and that they're able to maintain a social distance, but that's just not true.
So now the question we're getting is, what am I supposed to do? I can't even go to a state park. Officials understand, you need to get out. You don't want to get crazy. The weather's beautiful. They say go outside, but go in your backyard. Stay in your neighborhood. Whatever you do, don't drive out far to get your outdoors time in. Charlotte's a beautiful place. You don't have to travel very far to see it. Back to you.